Sunday, March 29th at 2 o'clock. This is a Board of Health emergency meeting. I am Mary Ellen Glover, Chairman of the Board of Health. We have with us Selectmen John Flynn and Don Davenport, as well as the Town Administrator. This meeting is being held to request of Lori.
Oops, you're breaking up. Hello?
Yeah, again, okay? He's being held at the request of Lori McCool, Hampden Board of Health agent, to develop a consensus decision on dealing with a recent positive COVID-19 diagnosis. The basic problem is that food is considered an essential service by the government. The town has only one full-service market that can provide adequate groceries to the residents. I would ask Lori if she can to state the question that she has to put before the board for our discussion.
Yes, okay. So I just want to let you know that I had received a phone call from the market indicating that they had an employee who has tested positive for the COVID-19. Just a little bit of background and let you know if I got this wrong, but the employee was at work last Saturday and was feeling fine. When the employee went home, they're closed on Sunday. The employee was at home on Sunday, started not feeling well, ended up going to get tested. The test came back positive. The results didn't come in until yesterday. So the whole week he was out of work. And then, so Gary called me to find out, what's our protocol. So we had a little bit of a discussion at the time. And so the employee was asymptomatic when he was at work. And as I was looking through some of the interim guidance for businesses and employers from the CDC, just so that the board has a little bit of background on what that protocol is. It does say that if an employee who appears to have symptoms such as fever, cough, or shortness of breath, when they come to work or who become sick during the day, they should immediately be separated from the other employees, customers, and visitors. This employee was not at work while he became symptomatic. Secondly, if an employee is then confirmed to have positive COVID-19, employers should inform the fellow employees of their possible exposure in the workplace, but maintain confidentiality. The fellow employees should then self-monitor for symptoms, such as the fever, cough, and shortness of breath. I did speak today, this morning I spoke with the health director in Chicopee regarding the closure of Arnold's, and she explained to me that the employee at Arnold's apparently was showing symptoms while he was at work for a few days. So there's just a little bit of every situation is a little bit different. So so what I'm asking the board is I see that there's three different possibilities. One is that the business maintains what they have, and throughout this whole process they've done all the proper protocol as far as cleaning, sanitizing, tell employees that if they're not feeling well, they should stay home. And, Gary could maybe say a little bit more about that. So the first thing would be we continue as we have been for the past week. Secondly is maybe closing the area where the employee was working for another week, just to add additional, maybe if that's an additional protection. And then the third option would be just to close the entire store. It appears to me that some of the recommendations by the CDC for an employee who even appears to have symptoms when they come to work or get sick during work, that they get sent home immediately, and then everybody else just self-monitors. So that's kind of where, I'm just wondering how the board would feel about any of or all of these options.
This is Don Davenport. Laurie, so the employee hadn't been there for a week, right? It was last Saturday, the 21st,
The 21st.
right? And he
That's
hasn't been
correct.
there since. Right, and he wasn't there Sunday, has symptoms on Monday, and hasn't been in all week.
Correct.
Okay, all right. And Gary, what do you guys sanitize all that stuff all the time, right? I mean, are you doing anything extra?
Well, we go through the store every morning and during the course of the day and make sure all the handles are cleaned and sanitized. Anything that people touch, we try to make sure that it's cleaned and sanitized.
Okay.
And do your employees do that sanitizing, or do you have a private company that does that?
We do it ourselves.
And then you spoke with some of your other employees, Gary, regarding their current health status?
Yes, I've reached out to everyone since I spoke to Rob yesterday afternoon, and I told them what has happened and how do you feel, and as Lori's recommendation was to make sure before you come to work to give yourself a thermometer to make sure that you don't have a low-grade fever, and if you do, please call and tell me that you're not coming in. So there's been a few employees prior to Rob calling, or even prior to last Saturday, choosing not to work this week because of the virus and all the contact we have with a lot of different people. So, but everybody's been made aware of it, and everybody's, I will call them after this meeting to tell them what the decision of the board and everybody else is.
Gary, the product that he was handling, these are all butcher that would then be cooked when people got them home?
Yes.
So, all right.
It's all raw product, yes.
Right, okay.
And don't forget that when they're handling any food, they're also
Glove.
not doing so with dirty hands, so they're constantly providing protection because there's no direct hand
No,
contact
say it
with
again.
ready to eat.
Right.
And so all of the procedures that are required by any food service establishment is what they've been conducting.
And looking at some past history over the couple of weeks with other food stores, the larger chain, I noticed that whenever they have an employee that's positive, they don't close the store. They do their sanitizing and notify their employees and just continue. So I'm comfortable with that Gary's taking all the appropriate steps, and he just should continue.
Yeah.
It
is a essential service.
Right. Is that a recommendation, or you would agree with Don on that as well?
Yeah, I mean, I think what we can say is that we are following CDC guidelines, unless the guidelines change, which they constantly do. But these changes were made as of March 21st, 2020, was the last summary of guidance for businesses and employers to respond to this virus. So what I read came strictly out of CDC guidelines.
Okay.
Well, if to assure the public's confidence, it would seem to me that we need a thorough sanitization rather than just the door handles and the, as Gary has spoken already, and whether that should be done by their employees or whether it should be done by a private company that's certified to do that. I think that would go a long way in building confidence amongst the public that the establishment is safe to continue to do business with. Would you consider that, anybody that's listening? Any response?
Well, I'm not sure that, I think if it was more of, I'm not sure that we need a private company to come in to do it, because certainly, it's my feeling that as long as the proper products are used, because this is what every place does on a constant basis anyway. But I think if Gary does, go back today, and it was just one specific area anyway, but that if he goes back today and whatever employees can just really do another thorough cleaning and sanitizing of all those touch surfaces and whatnot. It certainly would. I would say that would probably suffice. I think one of the things that came up in Gary and my conversation was that he felt that he would like to put it out to the public that he did have somebody positive that worked at the store, because he felt that by not saying something, if somebody does find out in such, in a small town like Hampden, that he didn't want anybody to feel that he was keeping it from them. But I think if we do put it out, and if he does put out some type of a statement, just saying that there was and we really have to be very, 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 very careful that we don't put out anything in public of who that person was.
Exactly.
So if he would put out a statement that there was a positive employee, that the employee was not symptomatic at the time he was at work, but later tested positive and has not been back to work, that that we're following CDC guidelines on how we are handling this situation at this moment, and that we are we have cleaned and sanitized, and we are doing our best to make sure that the customers to our store are provided the best the best that can be offered for protecting the public.
And do we provide, or does Gary provide, or does the CDC provide employees with written guidelines and resources that they can go to going forward, or is that beyond our?
No, there's a ton of information on the CDC guidelines for employers and employees, and so it talks about preparing the workplace. It talks about reducing transmission among employees. The employees have to know that even if they have somebody at home that's sick, that they should contact their employer and decide what should be considered. It tells people what they do when, washing your hands for 20 seconds and sanitizer with 60% alcohol, and and that Gary is providing his employees to go through that procedure throughout the day. And, that's how the place is set up. You can clean and wash your hands all day long. After touching anything or handing anything over to a customer or whatever. And then social distancing among employees, as well as, the customers themselves is also important.
Did you say something? Did we lose somebody?
No, I'm still here.
Oh, okay. Well, I certainly think that we want to continue, food service in Hampden, and we want the market to stay open. But we also want the public to feel comfortable. And I think Gary's suggestion of sharing the information in a way that doesn't divulge who the person is certainly commendable, and appropriate. I'm wondering if he would consider down the road establishing phone orders where people could come and pick up their food if they were not comfortable, or because some people are now placing orders on the internet, other people aren't comfortable with the internet, and particularly the seniors. I'm wondering if that would be a service that he would consider down the road. Not that that's part of this decision, but it does seem to me that the elderly are the people that we want to be concerned about.
You deliver now, don't you, Gary?
I do. I do, and it's mostly to the elderly or people who are housebound. So, but that's one of the things I intend to mention. If you'd like, I could read you the summary of what I wanted to say online.
Sure. Great.
Okay. To our customers, one of our employees has tested positive for the coronavirus. The test results came in yesterday afternoon. This employee has not worked since Saturday, the 21st of March. No other employees are exhibiting symptoms of the virus. And after discussing the situation with the Hampden Board of Health, we will continue our operations. Delivery and drive-up pickup are an option.
Oh, great.
Mm-hmm.
That's very
Does the board
clear.
think that the town has any, plays any part in communicating this to the public?
No.
No.
No. Right. Okay.
No.
Gary, the only thing I would add is that we continue to follow the latest sanitation guidelines, you know.
Yep.
Yeah, I think that's a good,
Yeah.
a good addition.
Right. And I
Add a
would say that you
sentence
are,
there.
and you're following CDC guidelines,
Mhm.
which is what you're doing. So,
Okay.
The other thing that I have, I was in there the other day, and the people that were there were commenting about the 6-foot distancing, which, because it's a small market, is very hard to maintain. And so I don't know if there's anything that you can do to encourage that, or to, I mean, people were leaning, you know, it was crowded, and there were 2 people said it to me. What's with the 6 feet? We don't have 6 feet. So just
Yeah.
for your information.
And I'm wondering if one of my options should be to limit the number of people coming in the store. And,
you can certainly do that.
That is probably an option that I'll take a look at and see if we can address it. And I think I'll put some lines on the floor just to be 6 feet apart.
Yeah,
And
right.
try to kind of
Exactly.
like do a configuration where people would stand and not be in any other person's way.
Yep.
Right, right. And
You know,
doing
maybe what,
go ahead, Laura.
no, I'm saying too, like even with that, you know, is, you know, people get nervous when they're walking down the aisle and they're facing each other. I mean, your market is small enough that maybe you could just have this aisle you go this way, the next aisle you come up the other way. You know, like one way up and down
I
the
got you.
aisle.
Yep.
That way
Okay.
people can be 6 feet away and not have to face each other. Just
Right,
an
and
idea.
those are sort of little changes that build the confidence of the public, I think.
Right.
You know,
That's a good
I
point.
agree.
So I like the idea of the arrows. When you come in, you walk and you go down the first aisle, and then you walk around, and then you come all the way to the last aisle, and then come up to the register. So, okay, I will do that.
And if
Okay.
people like at the butcher area, if there's like just spacing so that there's only so many people are 6 feet apart.
Okay.
And then it's really up to the public to do a lot on their part. We can only control what we can control.
Right.
And, you know, the public has to also make sure that they do their part.
that's right. All right, so unless anyone else has other comments, we would take a motion that, a motion that if anybody wants to state it, I guess. Or do we need a motion?
I don't think there's any official motion from our board. We've been informed. Gary's going to take action. Motion so
So you think
noted, basically, and close the meeting, I think, at this point.
I just,
Unless
I would-
Jeff has
use the mo-
something.
I would just like to say that, to thank Gary Laurie, for all they do for the community. Gary's been, you know, so great in volunteerism and helping out the community, and Laurie, you do a great job. Thank you very much, and let's continue working together.
Well, I
Thank you
would
for
certainly
saying that. I
second all of
appreciate
that. Right, that's absolutely right. Okay, so if there is no other business, then we'll take a motion to adjourn.
So moved.
Thank you.
Thank you,
All those in
everyone.
favor?
Jonathan and I.
Aye.
Mary Ellen Glover, aye.
Donald Davenport, aye.
Okay,
All right,
thank you
thank you
all.
all for coming, and have a good rest of your Sunday.
You
Thanks.
too.
Thank you.
Okay, be safe.
See you tomorrow
Thank you.
night
Bye-bye.
on the computer.
Yes.